How to reduce fever for children. Low-grade fevers are not harmful to children and may boost immunity when allowed to run their course. When a child's body temperature exceeds 102 degrees Fahrenheit, 38.9 degrees Celsius, the child is usually uncomfortable, and you should take action to reduce the fever. Bringing down your child's body temperature. Give your child the proper medication. Administer a dose of children's acetaminophen or ibuprofen. The Mayo Clinic says to only use fever-reducing medications when the fever is above 102 degrees Fahrenheit, 38.9 degrees Celsius. Most pediatricians recommend treating a fever above 102 degrees Fahrenheit, 38.9 degrees Celsius, or if the child is uncomfortable with any degree of fever. Both acetaminophen and ibuprofen products are available over the counter and are effective at reducing fever. It is safe to give acetaminophen to children who are over 2 months old, and it is safe to give ibuprofen to children who are more than 6 months old. Refer to the dosing guide on the product package or ask your doctor or pharmacist to measure an appropriate dose based on a child's weight. Acetaminophen will keep the fever down for 4 to 6 hours, and ibuprofen will lower the fever for 6 to 8 hours. Use only one type of fever reduction medication. Do not alternate doses of acetaminophen and ibuprofen unless instructed to by a physician. This method may be used in rare cases when the fever is above 104 degrees Fahrenheit, 40 degrees Celsius, and does not decrease after administering one type of medication. Cool your child off with water. Sponge the child in lukewarm water if the temperature remains above 104 degrees Fahrenheit, 40 degrees Celsius, 30 minutes after you have administered medication. Sit the child in 2 inches, 5.1 centimeters, of water that is 85 to 90 degrees Fahrenheit, 29 to 32 degrees Celsius. Use a sponge or washcloth to continuously moisten his bare skin. Shivering will cause the child's body temperature to rise, so slightly increase the water temperature if necessary. Alternatively, you can apply a lukewarm, wet cloth on forehead, hands, and feet to reduce the temperature. Keep your child well hydrated. Keep children hydrated with water, juice, popsicles, clear broth or drinks containing electrolytes that are intended to rehydrate the body. Have the child take small sips of water every 15 to 20 minutes. Juice and sports drinks, like Gatorade or Powerade, are not recommended for infants under 1 year old, as they don't provide the proper balance of electrolytes in young children. Pedialyte, or other electrolyte replacement drinks designed for children, are ideal for ensuring proper hydration. Make sure your child rests. When combating a fever, it is of the utmost importance that your child gets plenty of rest. Making your child comfortable. Dress your child appropriately. Dress feverish children in lightweight clothing and cover them with a thin blanket or sheet only if they are shivering or complaining of being cold. Heavy clothing and blankets prevent the body from naturally cooling itself. Keep the ambient temperature low. Lower the thermostat so the room temperature is slightly cooler than usual. Keep a fan close, if necessary, to keep your child cool. You can also open the windows if it is not too cold outside. Generally, anything below 68 degrees Fahrenheit, 20 degrees Celsius, outside would be too cold for a child with a fever. Provide support for the head. When your child is awake, make sure he or she has a comfortable, supportive pillow to rest his or her head on. Keep your child in one place. Extra or unnecessary movement will raise the body temperature in your child, so be sure they rest in one place and bring them what they need. Never allow your child to engage in strenuous activities when he or she is running a fever. Monitor the fever with a thermometer. You should know whether a fever is going up or down, or if it is staying steady. Check your child's temperature often and make sure you are following the proper instructions for thermometer use. Never use an oral thermometer on a child who has just drank or eaten something cold. This can skew the results the thermometer gives you. Rectal thermometers provide the most accurate results, especially for children under 1 year old, but are uncomfortable for the child and are more difficult for you to use when trying to get a proper reading. Treat other symptoms, when necessary. Most children who are running a fever will show other symptoms of illness, such as a stuffy or runny nose, sneezing, a headache, an upset stomach, or other physical symptoms. Use safe and effective measures to treat those other symptoms, as they can prevent your child from resting comfortably, which will ultimately help in reducing the fever. Recognizing and treating high-grade fever. Know when to contact your doctor. If your child is younger than 3 months old, contact the child's pediatrician anytime there is a fever above 100.4 degrees Fahrenheit, 38 degrees Celsius. For children older than 3 months with a fever under 104 degrees Fahrenheit, 40 degrees Celsius, you should call your doctor if the fever lasts more than 2 to 3 days. In these cases, your doctor should know whether or not your child needs to be monitored by medical professionals or if you can continue to treat the fever at home. Seek medical intervention. Immediately contact a physician or emergency services if a child has a fever above 105 degrees Fahrenheit, 40.6 degrees Celsius, no matter the age. Know when to call an ambulance. When your child is running a fever of 105 degrees Fahrenheit, 40.5 degrees Celsius, or above and starts having seizures or other neurological symptoms, is very lethargic, dehydrated, or if the fever is due to heat exhaustion, you should call an ambulance for immediate assistance. If the child has a temperature of 105 degrees Fahrenheit, 40.5 degrees Celsius, medical attention is necessary. Take your child to the doctor for assistance. Cool your child with lukewarm water. Apply lukewarm or room temperature water with a sponge or cloth to your child's head, neck, armpits, and wrists if his or her temperature is at or exceeds 105 degrees Fahrenheit, 40.5 degrees Celsius. This will provide a temporary reduction in body temperature. Give your child acetaminophen or ibuprofen right away to start bringing down the fever. Follow your doctor's instructions. After a doctor or medical professional has reduced your child's fever, he or she will provide you with monitoring and treatment options for the future. Follow your doctor's instructions closely to prevent another onset of dangerously high fever. Bring your child back for a follow-up visit. Even if your child's high-grade fever has seemingly been eliminated, it is critical you bring the child back for future follow-ups and visits with the doctor. This will help to eliminate any dangerous or potentially life-threatening complications in the future.